Uh, very good evening. I am Dr. Manish, presently working in the Sacred Heart Hospital, Jalandhar, Maqsuda. I am a nephrologist and have an experience of around 7 years in nephrology practice. So my current topic today, I am just going to highlight about the understanding of CKD and its classic symptoms and what the patient should not ignore. That is I think it's most important. What patient should not ignore. We should have to make them learn some of the symptoms which going to help in early diagnosis of CKD. So we can retard the progression as well as the complication. So welcome to today's session. So we will discuss. Now I'll start my topic. So first and foremost is what is chronic kidney disease. CKD effectively, we know that CKD effectively approximately 11% of adults worldwide, and around in India it's about 15.7%. We know it is a long-term condition where the kidney gradually lose the ability to function effectively. According to the KITCO to 2024 guidelines, CKD we know it is defined as abnormality in kidney structure or function, which is present at least for minimum, which present at least for minimum of 3 months. So it may be defined as a marker of kidney damage like albuminuria, more than 30 milligram per gram, urine sediment abnormalities, hematuria, electrolyte imbalance, histological imaging abnormalities, history of kidney transplantation, and persistent decrease in GFR less than 60 that must be present for persistent for more than 3 months. So in this way, we can define the CKD. So to diagnose CKD, the healthcare providers use a blood test, serum RFTs to check the GFR, and urine test to check the albumin. Once CKD is established, then we can categorize the CKD into 5 stages. So in these stages are defined by GFR as well as proteinuria. In CKD stage 1, we know the GFR is more than 90, or sometimes albuminuria or some functional proteinuria may be present. In stage 2, kidney function mildly decreased with GFR ranges between 59 to 60. In CKD stage 3A, kidney function again decreases mild to moderately with GFR between 45 to 59. In CKD stage 3B, kidney function decreased moderately to severe with GFR between 30 to 44. In stage 4, kidney function severely decreased and the GFR remains between 15 to 29. In stage 5, GFR is less than 15 and we termed this stage as a end-stage renal disease. So after categorizing CKD, uh, we can plan out the treatments. First, what are the symptoms of CKD? We should have to know because these CKDs are presently in early stage, it will be asymptomatic. So early detection is very important. So what are the symptoms? One common feature is fatigue, swelling, and this is mainly noticeable in the ankles, feet, hands, and sometimes changes in urination, frequency of urination will be changed, volume may decrease, sometimes presence of blood, microhematuria, or foamy urine. The patient may land up with the shortness of breath, persistent nausea and vomiting, loss of appetite, muscle cramps, itchy skin. These are the various manifestations of CKD. So next question comes, what are the risk factors associated with CKD? We know presently in India, diabetes is the most common reason for the CKD. Another common reason is hypertension, then glomerular disease, then some pyelonephritis or some Charcot abnormalities. So one of the risk factors is diabetes and hypertension. So early detection of diabetes and hypertension can retard the progression of CKD. In diabetes, what we have to we have to check random blood sugar, and we have to correctly plan our therapy accordingly. If there is a family history of kidney disease, age, obesity, these all are the risk factors for the CKD. So we have to avoid the alcohol, we have to avoid the cigarette smoking. So these are the various risk factors which are associated with CKD. So knowing these risk factors, we can prevent or help in early detection of the CKD. Why another question comes, why CKD is missed in early, it is remains undetected in early stages because it is mostly asymptomatic nature, and mostly the abnormality will be in the urine or proteinuria will be there which can be easily missed. Or hypertension, we are ignoring the hypertension. We're not going to ignore, just by ignoring the hypertension or not treating itself. It is one of the risk factor, because long term hypertension may result in the hypertension nephropathy, which finally leads to CKD. So early stages, early detection of hypertension help help in many ways to prevent the chronic kidney disease. And secondly, one another important point is that patients also are not aware about the CKD. So we have to make them sure. We have to teach them various parameters. We can these can help in or suggest the patient is having some sort of chronic kidney disease. So it is not detected early, then it can lead to some serious complications, because we know CKD, it manifests in various type of disease like cardiovascular disease, anemia, bone mineral disease, electrolyte imbalance. There will be fluid retention, uremic symptoms, and there's a because these patients are very immunocompromised, so there's an increased infection risk and sleep problems. So these serious complication can be uh, we can stop if we can detect the CKD at early stage. So how can we manage the chronic disease and this reduce the risk of complication? There are some essential steps we can take it in even home. So first and foremost, foremost thing important is regular monitoring of what we can regular monitor. We can regular monitor with GFR. So see, just to say a blood sample we can take, and we can do the RFTs, and we can through that we can calculate the GFR. And albuminuria, simple urine routine test, we can detect albuminuria for all patients. And those who are having high risk, we can check them at frequent intervals. Next, another thing that I already told before, we have to control the blood pressure and blood glucose level. Another thing, we have to manage anemia in the CKD, because we know when the GFR is less than 60, the anemia manifests. So we have to correct it by giving some iron tablets, or if there is it remains, then we have to go for some erythropoietic stimulating agents. We have to address bone health, because chronic kidney disease associated with multiple bony complications in the form of bone turnover and high bone turnover. So we have to address bone health always. So accordingly, and after we have to see the report, and we can use therapies like vitamin D supplements or phosphate binders. And the one thing is lifestyle changes. That is foremost important thing. We have to control the salt resistant diet, avoid processed foods, and this we have to avoid the saturated fatty acids and regular exercise. Um, these are the important steps we can do in lifestyle changes. So can we modify the disease progression? Another important is patient education. If patient knows about the symptoms of CKD, then he can have a regular visit at the physician. In advanced cases, we can know when to start the dialysis and when to start for the another kidney replacement therapy. This only can be possible if patient have a regular visit at the clinics. So, what are the KidCode 2024 guidelines? Is that if GFR and albuminuria should be monitored at least annually once CKD is diagnosed. For high risk patient, these parameters should be checked at least twice a year, and those with high risk, monitoring should be done at least 3 times annually. So, regular symptom check plays a crucial role in CKD management, because it helps in early detection and progression, prevention of complication. We can adjust the treatment plans, we can improve the quality of life and preparation of advanced stages, and we can provide them and offer them dialysis and the other kidney replacement modality therapies. I think this is much enough. And lastly, so in nutshell, regular symptom checks plays a crucial role in CKD management by enabling early detection, preventing complication, optimizing treatment plans, and improving quality of life, empowering patients and preparing for future care needs. Make sure to stay proactive and work closely with your healthcare team to manage the CKD effectively. Thank you. Any other questions?